What can I do to prevent spread and protect myself? The most important things you can do to protect yourself from COVID-19, as well as seasonal respiratory infections, like flu and cold, is to practice good, basic hygiene. That is, wash your hands frequently and thoroughly. Make sure you wash your hands with soap and water for 20 seconds, the time it takes you to hum the happy birthday song twice. One clever Twitter user came up with some alternative tunes for your mid-scrubbing pleasure. You should especially wash your hands before eating, after using the restroom, sneezing, coughing, or blowing your nose. If you can't get to a sink, use a hand sanitizer that has at least 60% alcohol. The CDC says, avoid touching your face, particularly your eyes, nose, and mouth. If you cough or sneeze, cover your face with your elbow or a tissue. If you use a tissue, throw the tissue away promptly, then go wash your hands. Avoid close contact with sick people. If you think someone has a respiratory infection, it's safest to stay 2 meters away. If you are sick, try to stay home to get better and avoid spreading the infection. Regularly disinfect commonly touched surfaces and items in your house, such as doorknobs and countertops. The WHO recommended method for hand washing. WHO: should I get a flu vaccine? Yes, getting a flu vaccine will protect you from the seasonal influenza and help prevent you from spreading that virus, though the vaccine is not 100% effective. If you do still get sick with the flu after you are vaccinated, your illness will be milder than if you did not get vaccinated. Getting a flu vaccine is something you should do every year to protect yourself and your community, including those most vulnerable to the infection and those who cannot get vaccinated for medical reasons. But, amid the COVID-19 epidemic, getting a flu shot is even more important. COVID-19 can resemble the symptoms of influenza. If people are vaccinated against the flu and there are few cases of flu in an area, it may make spotting new COVID-19 cases easier. Moreover, healthcare systems around the country are already stretched thin by flu patients who need care and hospitalization each season. In this flu season so far, the CDC estimates that flu is responsible for up to 21 million medical visits and 560,000 hospitalizations. Fewer flu patients means more healthcare resources can be directed to detect and treat COVID-19 cases and thwart the epidemic. When, if ever, should I buy or use a face mask? If you are not sick, do not buy a face mask. If you have one already and you are well, it is not recommended that you use it. Face masks are now in short supply globally, and prices have surged. This is making it difficult for healthcare workers to get the supplies they need to keep themselves safe so they can stay healthy, keep treating patients, and avoid spreading the infection. This tragic situation is exacerbating the outbreak. In a March 3 plea, the WHO called on industry and governments to step up production of masks and help thwart inappropriate buying. The World Health Organization has warned that severe and mounting disruption to the global supply of personal protective equipment, PPE, caused by rising demand, panic buying, hoarding and misuse, is putting lives at risk from the new coronavirus and other infectious diseases, the agency said in a statement. We can't stop COVID-19 without protecting health workers first, WHO Director General Dr. Tedros said. In addition to putting healthcare workers at risk, wearing a mask may also put you at risk. For one thing, face masks are not entirely effective. Masks still leave your eyes exposed. If rubbed with germy hands, they can be an entry point for viruses. Surgical masks are loose-fitting and leave open the possibility of infectious particles working their way around the mouth. Even the use of N95 respirators, which are designed to protect against respiratory droplets, may not be that helpful to you, since they require proper fitting, and many people do not wear them correctly or consistently. Some experts suggest that when members of the public wear face masks, they tend to fuss with them and touch their faces more. This increases the risk of transferring pathogens from hands to entry points. Also, if you touch the outside surface of a contaminated face mask, you can then contaminate your hand and go on to infect yourself. This negates the purpose of wearing a face mask. Last, some health experts worry that wearing face masks may give people a false sense of security, potentially making them lax about other precautions and protections. The only time experts recommend that members of the public wear a mask is if they are caring for a sick person or are already sick and showing signs of COVID-19. In that case, wearing a mask could reduce the risk that you will spread the infection to others. Otherwise, masks should be reserved for healthcare workers. Should I avoid large gatherings and travel? Updated the 13th of March 2020. Yes, if you live in the US, experts say that now is the time for social distancing measures, that is, putting distance between you and other people as much as possible. Avoid gatherings, unnecessary outings, and any unnecessary travel. If you can work from home, do so. School systems are already starting to close in many places. If yours hasn't yet, start making plans of what you'll do if or when it does. If you need to go to the doctor, call ahead and ask about telehealth options. If you must go out or travel, try to stay 2 meters, about 6 feet, away from people. Practice good hygiene. Wash your hands with soap and water frequently. Cough and sneeze into your elbow. Avoid touching your face. Social distancing is not a panacea. Dr. Michael Ryan, Executive Director of WHO's Health Emergencies Program, cautioned in a press briefing March 13. This isn't going to stop the epidemic, he explained, but it will slow it down and allow health systems to better cope with the burden of mounting COVID-19 cases. Though most cases of COVID-19 are mild, many will require hospitalization. In a study of 44,672 cases in China, around 14% needed hospitalization. If a scenario close to this plays out in the US, every hospital bed in the US may be occupied by mid-May. According to some estimates, social distancing may help avoid or delay that. But ultimately the way to stop the epidemic is for officials to start widespread testing, identify cases, put infected people in isolation, trace their contacts, put them in quarantine, and continue monitoring. So far, that has not been happening in the US. The country's response has been severely crippled by extremely limited and slow testing. As a country, we are not doing enough testing to know how far SARS-CoV-2 has spread in communities now, let alone to prevent further spread. The worst of the outbreak is yet to come for the US. Dr. Anthony Fauci, director of the NIS National Institute of Allergy and Infectious Diseases, said in a congressional hearing on Wednesday, March 11, "I can say we will see more cases, and things will get worse than they are right now." Fauci said, "How much worse we'll get will depend on our ability to do two things: to contain the influx of people who are infected coming from the outside, and the ability to contain and mitigate within our own country. For those who must travel internationally, the CDC provides risk assessments and travel guidance on its website here. For people outside of the US, in areas where SARS-CoV-2 is not yet known to be circulating, the original response from the 3rd of August 2020 is below. Unfortunately, there is no clear or general answer to the question of travel and attending large gatherings. Like your risk of exposure generally, risk from attending events and traveling depend on where you are and where you are going. Anytime you're faced with such a decision amid this epidemic, you should consider not only your local risk but also whether you will encounter people from high-risk areas while traveling to the event or once you are at it. For local events largely attended by local people in communities where there are no or limited cases, attending is considered low risk. Traveling to or through areas experiencing large clusters of cases will certainly increase your risk of contracting COVID-19. Attending a conference where there will be groups of people from high-risk areas also increases your risk. But of course, these risk assessments only hold up if we have a firm grasp of where the virus is circulating. Right now, we're not in a good place to assess this. According to Harvard epidemiology professor Mark Lipsitch, a month ago, it was easier to answer and, I think, a month from now it will be easier to answer, Lipsitch said in a COVID-19 forum at Harvard on March 2. Right now, it's possibly the hardest time to answer. Earlier, the outbreak was mostly in China's Hubei province, so it was easy to recommend travel restrictions to and from there. And a month from now, the virus may be so widespread that traveling doesn't change your risk much, or it could be contained and it will be clear which places are low or high risk. We can hope. But for now, the virus is scattering around the globe. It's hard to pin down which places are low and high risk. With new cases popping up continually, the situation in any given place can change at a dizzying pace. For anyone facing criticism of being too cautious, Lipsitch did say that limiting optional travel makes a lot of sense, high risk or not. It's part of a response to try to slow this down. What precautions should I take if I do travel? If you must travel, avoid contact with sick people, wash your hands frequently, use hand sanitizer, and avoid touching your face. If you're traveling by air, avoid layovers in high-risk areas.